Now, there's been no let-up in the Philippines either. 7 more people have died, taking the death toll there to 78. There are also almost 130 new infections. It's been 2 weeks since the main island of Luzon was placed under lockdown. Many are speculating that the enhanced community quarantine could be extended beyond the 12th of April. President Rodrigo Duterte is meeting government officials right now and will address the nation later this evening. Cherry Regalado joins us for more on this from Manila. Cherry, 2 weeks on, we're nearly at the halfway mark of the lockdown in Luzon now. Has the quarantine helped to curb the spread of the virus?
Well, it's too early to tell if the Philippines is winning the war against COVID-19. This was the statement of Health Secretary Francisco Duque a few days ago. He said it was too premature to say if the enhanced community quarantine or ECQ is significantly lowering the transmission of the virus within communities. Just today, the Health Secretary stressed that it's too early to determine if the ECQ should be lifted or extended beyond April 14. He cited the case of Wuhan City in China, where the lockdown has not been completely lifted 2 months after it took effect. But Interior Secretary Eduardo Año has a different take. He says extending the ECQ is not advisable as it would negatively impact the local economy. The Secretary adds that he is confident that the government can lift the ECQ if everyone cooperates by staying at home.
How are hospitals coping with the influx of cases?
Well, several hospitals in Metro Manila as early as last week have already closed their doors on COVID-19 patients, saying that they are already operating on full capacity. Plus, they are also dealing with shortage of medical workers as hundreds of their doctors and nurses are already in quarantine. Many hospitals, both private and public hospitals, are running out of PPEs and supplies, and they have been asking for donations as well. 2 weeks ago, private hospitals signed a manifesto asking the health department to designate referral hospitals to look after COVID-19 cases. They warn that the healthcare system will break down if no referral hospitals can take care of the influx of the COVID-19 cases. In response, the government has already designated 3 public hospitals which are now being retrofitted and are transitioning to handle COVID-19 patients.
All right, many thanks for that, Cherry Regalado, speaking to us from Manila.